A very good morning to one and all. I am Tintu Thomas and I'll be your moderator for today's session of Aster Volunteers webinar series on COVID-19 in pregnancy, lactating women and vaccination guidelines. Due to the COVID-19 pandemic, the last year has made us all adapt to an unforeseen circumstance that has now become the new normal for all of us. Aster volunteers have been at the forefront of this change, working to make a difference. These efforts have touched over 2 million lives by providing support in the form of food, ration kits, medical camps, PPE distribution and so on. This impact, as our motto says, has been powered by humanity. This was all possible thanks to all volunteers who came from all walks of life. If you wish to be part of this community, feel free to register yourself as a volunteer at our website astervolunteers.com. Our efforts to empower others have also included several webinar sessions conducted, reaching an audience of nearly 500,000. We hope that through this seminar, with the guidance of experts from Aster DM, we will be able to ease some of your worries. We will also have a 15 minutes question and answer session at the end of this webinar, wherein you are free to ask your questions through the chat box and our panelists will do their best to answer them. February 3rd, as we celebrate as Women Physician Day, and today we recognize one such physician, we have with us Dr. Kaveri Sharma. Good morning, Dr. Kaveri.
Very good morning.
Dr. Kaveri Sharma has had more than 10 years of experience in the field of obstetrics and gynecology. She is trained in the management of obstetric emergencies and high-risk pregnancies, management and gynecological ailment and cancer screening. She also holds a fellowship in infertility. She has a keen interest in academics and research. She has published various articles in international and national journals. I hand over to Dr. Kaveri to proceed with the session.
Thank you very much, Tintu, for that very generous introduction, and I hope I am able to live up to it, and at the end of the program, I hope I am able to answer most of the doubts and queries that everyone might have. And yes, hello and a very good morning to all of you who have tuned in. And I hope everyone is keeping healthy and staying safe. So here we are in 2021, and it's been more than 1 year since the pandemic hit us, and we are still with the virus. Now, I think one of the most important lessons that we have learned from the past year is the fact that it takes something as minute as a virus to wreak havoc in our world. And so I hope all of us take this lesson positively and carry on with all the precautionary measures that will help us to put an end to this pandemic. Today I'm here basically to talk about COVID-19 infection in pregnancy and breastfeeding women, and also vaccination guidelines regarding them. See, a positive diagnosis of COVID-19 infection itself is enough to, create a lot of apprehension and anxiety in those who get infected. And if it is a pregnant woman, then obviously, everything is doubled up because there are two persons involved, the unborn baby as well as the mother. Now, before I delve into the topic, I'd just like to give a small introductory information about the coronavirus. Now, so this is not the first time that we have had a coronavirus outbreak. We have had coronavirus outbreaks in the past in the form of the Middle East Respiratory Syndrome and SARS. And in fact, the first coronavirus infection was first reported in the mid-1960s. But the reason we were not familiar with the name is because of the fact that never in history did it create a pandemic or an outbreak of this scale. as we all know, the first case was reported in the city of Wuhan in China, and it was in January 30, 2020, that WHO declared COVID-19 as a global health emergency. And since then, it has claimed about 2.2 million lives, which is enormous. So the symptoms, most of us are very familiar with the symptoms. I mean, we know about the symptoms, fever, fatigue, cough, body ache, it can be diarrhea, and there is something very typical, that is loss of smell and loss of taste, and breathing difficulty. Now, breathing difficulty is a symptom that requires immediate medical attention. Also, the symptoms can be very atypical, and we have had many patients who were totally asymptomatic. And some patients just presented with a headache. So in that way, it is very tricky. And one question that we commonly get is, why is COVID infection severe in some and mild in others? The reason is, the body's immunity. It plays a very important role in that, as well as the virulence of the viral strain. So in the last few months, we have heard about a new strain coming up. Fortunately for us, that strain does not have more virulence, in the sense that it does not cause very severe infection, but it is more infectious in the sense that it can spread faster. But luckily for us, the infection is not very severe. And the body's immunity, yes, as we age, we grow older, our immune system also gets weaker. So the elderly, they have weaker immune system, and they are at increased risk of more severe infection. And also people who have chronic conditions like diabetes or, renal disease, that is disorders of the kidney, and, chronic respiratory illness. And also people who are on medicines which cause suppression of the immune system, like patients who have undergone organ transplantation. They are on immunosuppressive drugs, and that also predisposes them to more severe infection. And having said that, I would like to stress upon the point that exceptions have been seen. Just because somebody is very young and healthy doesn't really mean that he or she can go around exposing himself or herself without taking precautionary measures. Because we have had numerous reports where very young and healthy adults with no risk factors have succumbed to the disease. So it is very important to carry on with the precautionary measures, irrespective of your age and health status. And yes, I'll try to keep the conversation, free of medical jargon as far as possible, because this is meant for the public so that everyone can understand. And see, I am a practicing specialist of OBGYN, and many of my patients are pregnant or they're breastfeeding. So one question that I commonly get is, does pregnancy increase the risk of severity? The answer is no. From the evidence that we have had so far, pregnancy has not been seen to increase the risk of severe infection. In fact, most of the pregnant women had a very mild flu-like symptoms. But then we also have to consider that pregnancy is a very special situation where the immune system undergoes a lot of modification so as to cater to a growing baby. Like, if someone gets an organ transplant from somebody else, our immune system will recognize it as something foreign and start attacking it. For that reason, we need to be on immunosuppressive medicines. But imagine an entire human being who is a different person growing inside your body, and still your immune system is not rejecting it. How does it happen? It can happen because our immune system undergoes a lot of modification so that it caters to the needs of the growing baby. And this itself can sometimes predispose to an increased risk of infection in pregnant women. And also some medications which are required in very severe symptoms may not be that safe for the baby. So that is the reason we should be more careful with pregnant women, although the evidence suggests that most of the pregnant women had only very minor infection. Another question is, can an infected mother pass COVID-19 to her unborn baby? The answer is no, according to the evidence that we have had so far. The virus has not been detected in the amniotic fluid. Amniotic fluid is the water surrounding the baby in the womb. So it has not been detected in the amniotic fluid of mothers who were infected with COVID-19. And so that kind of suggests that the babies are not infected. But then it is very early to say so, because it's been only about more than a year since we had this virus. And how does it affect the pregnancy? Yes, not much. Your pregnancy will very much have the same course as another pregnant lady who did not have the infection. But there have been few reports of preterm labor. Now, preterm labor is when the labor pains start before the baby attains lung maturity. So there have been few reports of preterm labor in women who were infected with COVID, but whether it was because of the COVID infection or for some other factors, it's not really well proven. And there have been placental changes too. Some reports say that there are changes in the placenta. Now, placenta is an organ that supplies blood to the baby, to the umbilical cord. So if the placenta is affected, usually the baby's growth suffers. So a few reports have said that the placental change, she should discuss with her doctor and take a COVID test as soon as possible. Until the report of the test comes, she should isolate herself from other members of the household, and she should have a private, separate bedroom with a separate bath, practice hand hygiene and physical distancing with other members of the household. Now, okay, the test report has come, she's pregnant and she tested positive. Now what? Now, see, in the last 1 month, I had about 5 or 6 pregnant patients who tested positive for COVID. And the first reaction was that of, shock. They are terrified. What will happen? But one thing I want to say that please keep calm. Keep calm, because 99.9% you will have a very smooth course and nothing will happen to you and your baby. Now, those who are asymptomatic, usually the current recent guidelines say 10 days are enough. And at the end of the quarantine also, they will be given an end of quarantine certificate, after which they can move around. So that will be decided by the health authority guidelines. And by this, I mean the Dubai Health Authority guidelines. Since we are in Dubai, I'll be mostly touching upon the DHA guidelines. And when in quarantine, the mother can monitor her temperature. It's always a good idea to have a thermometer in hand and measure your temperature, monitor it, isolate the household, and if possible, use disposable cutlery. Now, how do you boost your immunity? Well, it's actually simple. You should have a very well-balanced diet, stay physically active. Now, yes, I include this as much as possible in your diet. And probiotics. Probiotics actually are substances which contain good bacteria, which help to boost our immunity. And one of the most common, easily available probiotic is curd. You can include curd in your diet. Now, another question that I get commonly asked is, will COVID-19 change the course of my pregnancy? No. The COVID-19 is unlikely to change the course of your pregnancy, and the antenatal care will remain mostly the same. And yes, there has been recently more interest and emphasis on teleconsultation. Now, that would be decided by your obstetrician, because pregnancy, we need to examine the patient, we need to see the growth of the baby, we need to hear the fetal heart rate. So teleconsultation may not always be possible. Yes, we can reduce the number of visits, but we cannot totally cut off the visits. Visits are important. The answer is no. It does not reduce your chances of a normal delivery. As I've told you, it doesn't really has an impact on the course of your pregnancy. So if you are taken for a C-section, it will most likely be because of an obstetric indication and not because of COVID-19 infection. But yes, there might be situations when the infection is so severe and the mother is in severe respiratory distress, and we need to deliver the baby urgently. But this is a very rare scenario and a very complicated one. Disciplinary team for the care, and fortunately for us, this is a very, very rare scenario. So coming to breastfeeding mothers, can an infected mother breastfeed? Now see, breast milk is very indispensable in the way that it has a lot of essential nutrients, and also it has substances which boost the immunity of the baby. It protects the newborn from many infections. So women are encouraged to breastfeed even if they have COVID infection and if their health condition allows them to breastfeed. Now, virus has not been isolated in breast milk, so it is unlikely that the virus will pass on to the baby through the breast milk. And if the woman has apprehensions, instead of going for directly breastfeeding the baby, she can also pump out her milk and feed the baby. Now, pumped milk, it can be stored in in the refrigerator. And if you are storing it in the normal refrigerator, it can be stored for a few days, maybe 1 to 2 days. And if you are storing it in the deep freezer, it can be stored to up to as long as 6 months. And in room temperature, it stays good till about 2 to 3 hours. So feeding the baby expressed milk, which is pumped out, is also a good idea if the mother has apprehensions. Now, how can an infected mother protect her baby if she decides to breastfeed? Yes, if the mother has infection and she wants to breastfeed her baby, she needs to take a lot of precautions so that she doesn't pass on the infection to the newborn. And the precautions are actually very simple. Wash your hands properly before feeding the baby. Wear a mask while feeding. And if you're using a pump, wash your hands before using the pump, before touching the pump, and also clean the pump, according to the normal instructions after every use. Now, coming to vaccination. So, see, this is something that we were all looking forward to, because so long we were just depending upon the precautionary measures to spread infection. But now, mostly a protein of the virus or a dead virus. Now, dead virus is a virus which has undergone some chemical processes which inactivates it so that it cannot cause the infection, but it still has all the proteins that a virus contains. So when this is introduced into the body, it stimulates the body's immune system to produce substances called antibodies which fight against the infection. So these antibodies will be there in your body, and next time when you are exposed to the same virus, you already have the ammunition, that is these antibodies to fight the virus even before it can cause an infection. So this is how it works. And there are many questions regarding how do the different vaccines that are available, they are different. They are different in the way depending upon what part of the virus they have used. Like there is a vaccine that we are currently using in the UAE, Sinopharm, which uses the inactivated virus. And the Pfizer vaccine, which also is available in Dubai, it has been obtained recently, I think. And that has a part of the virus which actually is a protein, it's mRNA. So this is how the different vaccines differ, like in what part of the virus they have, whether it's a part of the virus or it's a whole virus which has been inactivated. No, they are not advised to take the vaccine because it's very early to actually confirm or guarantee the safety of these vaccines in such women. Yes, we have had studies, but then they are just not enough. The data is not enough to establish the safety of this vaccine in pregnant and breastfeeding mother. So it's not advised according to DHA guidelines. But yes, the guidelines change according to the countries, because I think according to the American College of Obstetricians, pregnant women who are at high risk of exposure, like those working in COVID units or healthcare workers who are pregnant, they are advised to take, since the risk of infection is very high. But according to DHA guideline, not advised for breastfeeding mothers and pregnant mothers. So another question that I get frequently asked is, a woman is planning a pregnancy, can she take the vaccine? Now, again, by the DHA guidelines, if you're planning a pregnancy, it's better to avoid the vaccine. But under the current circumstances, I would suggest that first take the vaccine, then take a 3 months gap from the day of vaccination before planning again. So there should be a gap of at least 3 months from the date of vaccination before planning a pregnancy. Now, see, what can I expect after vaccination? After vaccination, obviously, there will be few side effects, like the common side effects that are reported are fatigue, headache, fever, swelling or pain on the site of injection, and muscle pain, joint pain. Most of the side effects are mild. You can take 00342, right? Yeah, and if the symptoms persist for more than a week, even then you need to get in touch with the health authority. Now, infected with COVID, can I take the vaccine? That means someone got the COVID infection already. Can she go ahead with the vaccine? The answer is yes, but you have to wait for at least 3 months. There should be a 90 days interval from the date of diagnosis of COVID till you take the vaccine. Now, can I get COVID-19 infection if I'm vaccinated? Yes, yes, yes. Even if you are vaccinated, you still can get the infection, but the symptoms will be milder. It's very unlikely that you will get severe symptoms once you're vaccinated. So it is very necessary to continue hand hygiene, physical distancing, mask, in spite of the fact that you were vaccinated. Will the vaccine protect me for my lifetime? It is very, very uncertain because it's a very new vaccine, and we are yet not very sure as to how long the protection to take the other vaccine as well. Can it be done? No. It is not safe to take one vaccine and then go take another vaccine for the same. And yes, you are vaccinated, so maybe I don't need to do PCR before I travel. I don't need to do COVID PCR before I get admitted in the hospital for an elective surgery. No, it's not that. You still have to undergo all the guidelines. Even if you're vaccinated, you need a COVID PCR before you travel. If it is required by the authority, and you still need to undergo a COVID PCR before you get admitted to the hospital for an elective procedure. And at least that is what the guidelines say till now. And do we need to follow precautionary measures after vaccination? Yes, yes, yes. Because vaccine doesn't really mean that you were totally protected from infection. So we still need to follow the precautionary measures in order to stop spreading the infection. And yeah, this page I have taken from the DHA guidelines, and these are the things that you must tell your doctor before taking the vaccine. Out of this, see, breastfeeding and pregnant mothers, obviously we are not advising. The other is if you have history of allergic reaction, severe allergic reaction to any food, any medicine, and if you need to carry an adrenaline which is self-injectable. Usually we call it EpiPen, they carry it with them because they have history of severe anaphylaxis. So if such a history is there, the health authority people will decide whether you can go ahead with the vaccination or not. So than anything that can happen to it. And yes, I think if we carry on with the precautions, we definitely shall overcome this pandemic. So that's it. I'm ready to take your questions.
Any concerns or questions, kindly type your questions in the chat box, and Dr. Kaveri Sharma will answer all the questions. So, meanwhile, till we get questions from the audience, I would like to ask you certain, certain doubts that I have. If a lactating woman who is breastfeeding her baby and she is very keen on breastfeeding, but she attains, she gets COVID and she's positive, and they are staying in a one-bedroom apartment, how does she quarantine herself?
Yeah, that is, because in Dubai we do have families who stay in one-bedroom apartments, and in such a scenario, she can ask for institutional quarantine. Okay. Institutional quarantine is when she will be shifted to a hospital or another place for quarantine by the health authority. and she can actually, there is, according to the guidelines, she can keep the baby with her if she wants, but she still has to maintain all the precautions, as I've told you, hand washing before feeding and mask.
And how long should this mother-baby precautions be taken care at home, even after the contact of a recent infection?
I mean, after an infection?
Yes.
Yes, still she is considered infection free. I mean, you know, the quarantine period is 10 days. Or see, previously it was required that you undergo a repeat COVID test, COVID PCR testing, to get a quarantine, end of quarantine certificate. But now if you have very mild symptoms and if you are afebrile, that means you don't have fever, without the use of medication, not with medication. If you don't have fever without the use of medications, you have very mild symptoms or asymptomatics, after 10 days you get an end of quarantine certificate even without undergoing a repeat COVID PCR. Because it's been seen that after 10 days with mild infection, it's very unlikely that you can pass on the infection to somebody else.
Okay.
But she can extend it to 14 days as well if she has apprehensions. But 10 days actually is enough. Yeah.
Okay, then there are certain questions that, you know, some of my colleagues have also they've pondered upon. If a pregnant woman who is COVID positive, should she take glucocorticosteroids in case if she has preterm labor pain, contractions or anything like that? Is it advisable?
This is for whom you are saying?
For pregnant woman. Yeah.
That will, you know, see, corticosteroids are basically given for lung maturation, right? So depending upon the health condition of the patient, how severe the symptoms are, and also depending upon the necessity of, suppose it's severely preterm baby, then maybe we can go ahead with the corticosteroids because that's very important from the baby's point of view. But it all depends on the situation, whether the woman has severe symptoms or not. If the doctor feels that she has severe symptoms and corticosteroids will not be a good idea, then, you know, better not to go.
Okay. And what about travel restrictions? Do you still feel that if a woman who is either pregnant or lactating, she should travel, or is it safe to travel with following the guidelines?
No, see, it's always you know, advisable to avoid unnecessary travel. If it is not required, don't.
Okay. So, do we have any other questions? We can continue with the session.
We have questions? That's it? Okay.
I'm sure this session was
We have questions?
Yes, we have one question. We have one question from Agila.
Yeah.
She says, hi doctor, when a pregnant woman gets COVID, it will have effect to the baby. Will it have an effect to the baby?
Akila, I think, yeah, I think she's one of my patients, yes. Akila, as I've mentioned in my presentation, if a pregnant woman gets COVID, it's very, very unlikely that the baby will be affected. Very, very unlikely. 99.9% you will have a normal course with your pregnancy. I hope that answers your question, Akila.
I'm sure doctor has covered all the topics, and whatever queries or doubts we were having about, we've been able to understand the topic more effectively. The session was extremely informative and fruitful to all of us. I would really like to thank Dr. Kaveri Sharma for having us and giving your input. It was so informative, and I would like to thank Aster volunteers who've come with this session, and we've tried to cater to the maximum population and to provide maximum knowledge to all those who need it. Thank you very much. Hope you have a nice day. Thank you.